hang on. Sorry, I forgot to record. Okay, I'm sorry. Go ahead.
Like I see this morning, I had a problem with the guy.
I can't hear you. Hang on. You're cutting in and out. I can't hear you. Can anybody hear the student, or is she cutting in and out?
She's breaking
Cutting in and out.
Okay.
Can you hear me now? Can you better?
Yep, that's better. Yep, go ahead.
Okay, so I was trying to explain that this morning when I'm with you, I explained that coming from maternity to ped, the way the study guide is always structured is kind of different from the way this particular study guide was structured. I don't know if any other person thinks the same way. For me, I really did flashcards from study guide. So when Danielle talked about study, I remember I had a lot. In fact, for every bullet point, I had one flashcard for every bullet point. Yet I was unable to really digest the study guide. The exam we had yesterday, the PEDS we had yesterday, that I was able to send you the copy so you guys can see how that study guide was structured. I think we need better way of communicating this study guide. There's so much topics, there's so much to read. So I think they need to work on this study guide.
Okay. Now we have used the same study guide in community for at least since I've been here. So this would be the 5th term we've used it. And remember that the community class is different. Community is more, it's community concepts. Okay, so there's the study guides that are going to be designed for peds and maternity may look different than the community. We're talking about topics, about concepts. So anybody else want to add to that, or can everybody turn their cameras on, please? Please.
Oh, the only thing I wanted to say was,
who is this?
It's Elizabeth. Can you see my name? Yeah.
Yep.
The only thing I can say, like I told you, for me, I felt like I wasn't all the way prepared for the test, but I also felt like when I went to I did go to all 3 reviews, and I felt like everybody was covering I felt like everybody was covering different information.
Okay.
Like it wasn't the same information being echoed at every reviews.
Okay.
You know what I mean? Yeah. So I felt like everybody was covering it maybe in a different way, but it just came across to me like now it's a lot of information that coming all together. Mm-hmm. Now I need to focus on everything, what you were trying to say, what the person was trying to say. So I felt like different information was being covered.
And part of the last, in week 2, when we did the review in the last hour, the only thing I did was a study guide. All right, we went through each topic on the study guide. Okay, I mean, we can't give the answers on the study guide, but we can identify topics and concepts that are going to be asked. So for example, where's the study guide? Like I said, all the topics were covered on the study guide except for one question. So for example, the very first bullet, it said risk factors, or it's priority and safety assessment, key concepts using ADPI, safety and delegation principles. The very first bullet on the study guide was risk factors. What are the risk factors for SIDS? That was your question. Okay, so that's one example. I want to go to the a lot of people miss the frontier nursing questions. So let's see where that was. Oh, let's see on CUSIN, right? Organizations that play a role in public health on page 2. Under it was some bullets of what you needed to know. One was, what is CUSIN? Quality and safety education. What are the CUSIN competencies? Okay, I took you back to chapter 1 and we highlighted that box, right? There were 6 competencies. Okay, what are the main objectives? So you had a question about that. Okay, then so I don't want to, I'm not going to rehash this out, but what I'm saying is that so much of this information was on the study guide. What I've heard from a lot of people already is that they were busy studying for med search. Is that right? Am I gathering that that's correct?
That is true.
Yeah,
I
that
see
is
here-
true. I mean, I had
to
split my time up, but I still spent a good amount of time studying for this exam.
Okay, so Danielle, what do you think? What do you think happened when you finished the exam? What did you think?
I mean, if I'm just being frank, I felt like I described it as a word salad. In my mind, I was like, okay, there's so many words. And I think that's where I was struggling, especially by the end of the exam. I was mentally tired of trying to separate out information. And little things like with frontier nursing, and that one threw me a little bit. I was really looking for keywords like midwives, like that was kind of where my, that's why that one threw me.
Okay.
So I think maybe I put too much information on my study guide. I just couldn't absorb it all. And
so that's
I don't know. For me, that's where I saw the challenge was there's a lot of information that it's very wordy. This is a very wordy class to me. I don't know how else to describe it.
Yeah.
And it's not necessarily information that just really sticks with you the first time you read it. There's it's very I don't know. That's where I struggled. I mean, I can only share my opinion, but for me, that's where it was kind of.
I agree. It's very wordy, and if you
there's subtle differences with some of these concepts that it's that's where I just kind of go,
okay.
Yeah.
Was it wordy a lot because it was the first exam and we had a lot of definitions and would that be okay?
Yeah.
Because I know the first few chapters deal with a lot of definitions and a lot of different organizations and things like that.
Yeah.
But I do to just to give some perspective on how I learned how I need to study for the next one. And I think that I just need to do a better job of compartmentalizing concepts. Correct. And rather than kind of like you do with med-surg, where it's systems, right? So you got to learn cardiovascular, you got to learn, kidneys, you got to learn adrenals. I think I need to kind of take a little bit more of that approach with this class and do a better job of like categorizing and then putting things in those boxes. And I didn't really do that on this test. I had a lot of information that was just sort of from over here and from over there. And
well, you said you went from a 4.5-page study guide to a 12-page study guide.
Right. And I should have told you this earlier. When I make my study guides, it's in like 14-point font so I can see it. So it's not like a true 12-page study guide.
Okay.
Yeah.
Well, there is a reason that we design the study guides like we do, because it is this class has too much knowledge. There's too much. Okay. So we really try and hone in with these study guides, what's going to be expected on the exam. So going forward, I really want you guys to focus on the study guide, at least for topics and concepts. And what you're having trouble with in the study guide, then you can go back to your other resources and take a peek. Your PowerPoints, your case studies, your book. Okay, but from several people I've met with already, it sounds like a lot of people were over studying, trying to over memorize things. And that's not what this class is intended to do. It's really intended to pull out a couple of key concepts, some essential knowledge from each chapter, and that's it. Not every chapter, everything in every chapter. Okay.
That makes sense.
What?
No, I was just saying that makes sense.
Yeah. Okay. All right. let's see, Ebony and Quinlau, could you guys turn on your cameras, please? Brianna, oh, there you are, Brianna. Okay. Where's Ebony and Quinlau?
I'm right here. When I turn on my camera, it doesn't, I keep getting kicked off. So I don't know. If I keep getting kicked off, I'll just.
Okay. All right. No, that's okay. I just want to see everybody's face to start out with. All right. A couple things we're gonna go through the vulnerable populations assignment that's due in week 9. That's 8% of your grade. I just want to go through that with you. And then I finished grading the case studies this morning. So all the grades are in there. Most were fine. There were a couple of groups that I couldn't understand that it wasn't submitted as a group. They were all individual entries and I had to piece everything together to find out who the group was. The intention of the assignment was to do it as a group, submit it as a group. A couple of groups did nice cover pages with who was listed in the group and who participated in what. That's what I kind of wanted to see, but there were several, I think there were 2 groups that everybody just did individual postings. I couldn't figure anything out. It took me a while to get those groups together. Does that make sense? And I put that in the feedback, and I've already heard from one student, she wants to talk to me about that, which is fine. But that's what happened.
So
Actually,
my group did both, because you sent out a message that said to submit individually, unless I read it wrong.
Actually, I think
so.
that was
My group did both.
Yeah, you guys did great. I mean, this class, I don't think it was in my other class. So,
yeah, you sent an
you guys did
email
great.
saying it.
This class did really well. So yeah, they were great. I mean, case studies were awesome. Awesome. You guys did a really good job. The other, I just want to go through this, and I'll post this in the announcements. So let me share my screen. We're going to go through infectious disease. Okay, so I'm going to put this in the announcement, but I want to show you guys what this was. This is your second. Okay, this is your second group project, and it's due in week 7. So I'm going through it with you now because I need by the end of the week for you guys to tell me what your group is going to do. Okay, so you have to go in here, this website right here, National Foundation for Infectious Diseases, and you need to pick an infectious disease your group is going to do. Okay, and that is incorrect.
Are you picking our groups again?
Nope, you're in the same groups. Same groups. So let's see. What is Sunday? Sunday is the 6th. So let's say by Sunday the 6th. Can't believe it's already February. Sunday the 6th, somebody in the group needs to send me an email of what infectious disease you're going to do. I just want to make sure there's no overlap. Okay. So in the past, people have done HIV, people have done, there's a whole, you have like, I think a dozen or so to choose from. So this is your next one. Okay. It's the same as before. You submit, which is, I'm going to put this in, I'll attach this to the announcements. You guys, you do your initial post by Wednesday and then reply to 2 classmates and put it right like you did before. It goes right in the discussion thread. Okay, so you're going to collectively decide on one infectious disease. Okay, somebody's going to send me what you're doing by February 6th. Here's my email. And then once you send it to me and I give you the okay, and it's not that I have to give you the okay, I just want to make sure everybody's not doing the same one. You need to include at least 2 different resources. And this is found in week 7 in your module, because that's the week it's due. Okay, and here's what you need to address. 1, 2, 3, 4, 5, 6, 7, 9 bullets with each infectious disease. Okay, I really would like this to be an APA format. I'd really like to have a cover page to know who's in the group. For those few that groups in this class that did that, that was very helpful. Please. Title page with all group members' names. Okay, so it's specifically asking for you to do it for this particular assignment. Okay, here's everything you're going to address with the disease. Okay, so I'll send that out to you. I want to just go in the module. Let's see. Nope, that's not it. That's not it. Let's see. I believe that is in number 7. Let's just double check. Group project. Oh, the other thing that's going to be, let's see. Here it is right here. So it is in week 7, the instructions, but I'm going to send it to you in the announcements. The other thing we're going to do with this particular one, this group assignment, is I'm going to send you out a group peer review. Okay, after you finish your project, you're going to do a group peer review. You don't have to do it on every person in your group, but how your group did putting this assignment together. Okay, so you have a peer review to do. Okay, so go through week 7. Okay, and then anybody have any questions on that? And then week 9, I like to introduce this early because vulnerable populations assignment isn't the kind of assignment you can start in week 8. It just isn't. It's a research paper. Okay, it's due in week 9. And so I'm in the module of week 9 right now, which is where you'll find the assignment details. Okay, please, for both the infectious disease as a group, I would suggest that you review the rubric together, just so you guys know how it's going to be graded. And then definitely for the vulnerable populations assignment, please review the rubric. So you know how this paper.
The vulnerable populations is not a group assignment, right? It's individual.
That's correct, Danielle.
Okay.
Yes, and it's due in week 9. Okay, so basically you're going to be picking a vulnerable population within the community you live in. Okay, and you're going to be doing a research paper. Here's some suggestions here of vulnerable populations that you can pick. If you want to pick something outside of this, please just let me know. And this population is an individual, or this assignment's an individual assignment, and it's a PowerPoint. You're going to be putting together a PowerPoint, a maximum of 10 slide maximum PowerPoint. Okay, so I really would like for you to read this assignment overview. And here's the seven topics you're going to be discussing. So let's say I picked the homeless population in Wheat Ridge, Colorado, where I live. Well, I need to discuss the demographics, the religion, ethnicity, culture, employment, and so on. I need to identify the health risks. Okay, so there's one section, there's a health risk, there's a demographics or population description. There's a health risk section, there's resources, service gaps, and summary. And here's the rubric. Here's your rubric. I believe it's divided into six 10-point sections. And they go right along with the guidelines right here. Okay, so take a look at that rubric right in week 9. Okay, and so please don't submit a paper that says the homeless population in the United States is so-and-so. Here's what homeless people need. Here's what they don't need. This is not a general research paper. This is a specific vulnerable population in the community you live. So you may need to contact the health department. You may need to contact government offices to get demographics, or you may need to go on their website, right? So if you pick pregnant adolescents, how are you going to get this information? I don't know. Okay, so that's your vulnerable population. It's due in week 9. So this is week 4. You have 5 weeks to do it. I'm not saying you need to get started right this second, but at least be thinking about it. I mean, can anybody off the top of their head identify a vulnerable population that sticks out in the community you live in, that you have not always wanted to, but that you would like to do more research on?
Veterans.
Veterans, there you go. Okay. Yep. So then what's the demographics of the veterans in your community? You know, if you can get the religious breakdown, ethnicity breakdown, I mean, it's a research paper. Okay. Does anybody have any questions about that paper? And don't let this be the paper that you don't turn in. This paper is actually worth 8% of your grade. So this is, you know, if for some reason at week 9 or 10, you're kind of on the cusp with grades, this will definitely help you, 8% of your grade. I mean, I hope nobody's in that situation, but don't let this be the assignment that you choose not to do. Okay, it is kind of a big assignment, 10 PowerPoint slides.
Is that a key graded assignment or just like
No,
a homework assignment?
it's homework. Yeah. So in order for this to get added in at the end, you need a 78% with your key graded assessments. Right? So this will be in week 9. So this is due the same week you're taking exam 3. Okay. So let's go through real quick. We're going to cover the 3 chapters from week 3 today. We're going to cover the 2 chapters from week 4. Is everybody able to get in so far to your HESI, or the ones that, have you tried your hospice case study? Okay, when you go in to do that, you have to access it through the module. Right here. All right, load case study, you have to do it through the module, through here. Okay, and then don't worry about submitting anything to me. This is an assignment that is populated right into the grade book. Okay. Did I get everybody in here? I was missing a few people. Jamie Wilson got in here. Did the other Jamie get in? Jamie Southard? Okay. And then Ebony got in, correct? Yep, okay. All right, so that's the case study for this week. So don't worry about sending me anything. It will populate. What else are we doing this week? And some of you, I think I have one student from this class, you guys do not forget to do your attestations, because that's the way the university looks at your attendance. You have to have two areas of attendance every single week. Okay, so attestation is one of them. So I have several people in the other class that haven't done their attestations for week 3. So whether you attend a class or not, if you didn't do your attestation, it's not counted. Okay, so let's go through. This week we have the hospice case study, and let's see what our attestation questions. What are the 2 parish models for faith community? What are the 5 practice models for home health and hospice? Okay. We'll go through those. And then let's just go back to week 3 and see what our attestation questions are. Oh, you guys have already done them. 2 barriers to rural health and homeless. We'll go through those. So let's just go ahead to week 5, which is next week, just to make sure you guys understand what's due. So next week we have a discussion question that's due, and we have NCLEX questions that are due. Okay, be careful about working ahead. So next week, for like this week, you only have 2 opportunities for attendance or for grading. The case study and attestation. So you have to complete both of them for your 2. Next week, you have 3, right? You have your attestation, you have your NCLEX and discussion 2. So you could work ahead on one of those. Does that make sense? But there needs to be 2 every week. Okay, so that's where you get going next week. Now remember, next week is week 5. So I hope to be able to spend the second half of lecture going through exam 2 study guide, which I'm hoping you have in the next couple of days. That's my goal. Okay, we're working on it as we speak. All righty. Questions? That's a lot of housekeeping stuff. Oof. Okay, questions?
I forgot about that rule of
What?
having to have 2
Yeah,
things per week. I think I did my hospice case study on Sunday. I forgot about that rule.
Okay, well, I'm not going to grade it till this week.
Okay.
Yeah, but you guys have to be careful about that.
Yeah, I
'Cause
forgot
there's-
about that. Thank you for the reminder.
You're welcome. If you work too far ahead, you're not going to have enough things to turn in. And attestation's 1, but there has to be another one. Okay, let's go. Oh, sorry. Quick question. Has anybody had a chance to review any of the PowerPoints from week 3? Does anybody know what we're talking about today? Okay, I'll take that as a no. And then does anybody, so we're going to be covering rural and migrant health. That's chapter 22. 23 is poverty, homelessness, teen pregnancy and mental health. And chapter 24 is alcohol, tobacco, and other drug problems in the community. Okay, so bear with me for a second. Okay. I want to go through these rather quickly because there's 2 Kahoots. There's one for week 3 and one for week 4. I mean, we could start there. And then I do have that I get from my instructor resources through Evolve. I have test bank questions that I'd like to go through with you guys as well. Okay, so let's cover. So if nobody has gone through week 3 information, let's just start with the objectives then. Okay. All right, so what do you guys think the difference between rural and urban is? Has anybody looked? What are the differences between rural and urban? You need to look that up in the book. Anybody? I need to be interactive. I can't. What's the difference between rural and urban? What's urban?
Urban is
more
city
city.
limits.
Yeah.
Okay. All right. So what's some differences between urban and rural?
Rural, I can never say it right, but it's
Rural, me
more,
too.
yeah, like when I think of it, it's more country vibe, more space. Usually these people are like far away from their next neighbor.
It's less businesses in the rural.
They usually have to travel further. That's where I think of like tractors on the road.
People have a harder time getting to appointments.
Yeah. Transportation is a barrier. Sure. What about access to healthcare, specialized healthcare? very limited. Right? The same there may be one doctor that covers 4 towns. He takes care of the newborns all the way up to your grandparents. Right? Describe the health status of rural populations. Okay. Well, one thing that's true about rural populations is they're less likely to seek care because of the challenges of getting care. So you're going to find a lot of the rural population, one of their major health issues are chronic diseases. Okay. Discuss access to services of rural underserved populations. Who's at risk? Kids are at risk in the rural.
The
elders, the children. Why? Why are the kids at risk?
Yeah, transportation.
Education, healthcare. They may not have a pediatrician. It may be the same general practitioner, right? Define migrant workers and discuss common health problems of this group. What are some common issues with migrant farm workers?
Language barrier.
Insurance.
Poverty. Exposures, health exposures, pesticides. They don't understand our health system. We don't understand their culture. Lots of stuff. Okay, so I'm just going to flip through these because I really want to get to the one thing I would suggest for these 5 chapters. Well, I'll get to it. Population characteristics for rural. Okay, take a look at that. Tend to be poorer. Rural populations tend to be poorer. They're higher, we already said, they're high risk for being underinsured or uninsured. Okay. They're less likely to engage in preventative behavior, right? And the 3rd bullet is what I was talking about. More likely to have one of the chronic diseases. Okay, and it lists out 5 or 6 chronic diseases, much more likely to have that, right? Tend to have poorer health, less likely to seek medical care. Traveling time, transportation issues. Okay. Okay, health providers. Maybe a health provider shortage in the areas, right? One of the things we're concerned about in rural health is maternal, specifically is maternal and infant health, right? Definitely higher infant and maternal morbidity rates, right? High proportion of racial minorities and fewer specialists, right? Extreme variations in pregnancy outcomes, okay? And particularly at risk are women who, and here's a couple of examples, live on or near Indian reservations, are migrant workers, are victims of sexual assault, are of African American descent and live in the rural counties of states in the Deep South. Okay, urban kids are more likely to see a pediatrician when they get sick, right? But rural kids are going to see general practitioners. What about the kids who work on farms? Very high risk. School nurses may play a huge role in rural health, right? They may be the immunization nurse, the pediatric nurse, the public health nurse. Okay, mental health is a big issue in rural America. Okay, delay seeking care. Okay, one of the things I want to mention to you is there's such a thing in rural health called anonymity or lack of. Okay, in the rural community, everybody knows everything about everybody, right? So when you have issues, child abuse, elder abuse, domestic violence, substance abuse, people are less likely to come forward because they don't want everybody to know. That's a fact. Okay, so that's a big issue, all right, with delaying seeking care. High rates of depression, domestic violence, big issue with rural health, but even a bigger issue with reporting of it, or less reporting of it, right? Lots of alcohol, tobacco, and other drug abuse. All right, you can read through this. Actually, let's know that we need to know this part right here. Number 12, very first bullet. You may get asked in your next exam, what kind of industries pose the biggest occupational environmental health problems in rural areas? Here's your 4 industries: forestry, mining, fishing, and agriculture. Okay. Another issue with rural health is common injuries, exposure to chemicals, rural healthcare delivery and barriers, affordable, accessible, and service professionals. And then, providers' attitudes, insights, and knowledge. I mean, if you ever had to be culturally competent and culturally sensitive, it would be working in a rural community, right? Because you're not sure which migrants you're going to be working with on any given cycle. Okay. Okay, what are some issues in migrant health? This is a good slide to know. This could potentially be a select all that apply question. Okay, what are some issues in migrant health? Look at them all. We've already talked about several of them already. Okay, so slide 15. Cultural considerations in migrant health, nurse-client relationship, health values and beliefs and practices. So once again, here's where we have to check our own beliefs, check our own values, check our own practices. Rural nursing is hard. If you're an urban nurse, you may wear 1 or 2 hats. Let's say you work in an urgent care clinic. That's your scope. But rural, you're bringing everything. You may be the only nurse up there and covering 4 or 5 communities. You may be caring for newborns. You may be the labor and delivery nurse, the newborn nurse, pediatric nurse, school nurse, right? Drug prevention nurse, mental health nurse. You got to bring it all with rural health. It brings in everything. Not to say that urban doesn't do the same thing, but rural, you really have to, you bring your entire scope. Would you agree? Okay, nursing care and community, nursing care in rural environments. Well, here's what we just went over. All the different roles you might be playing or being responsible for. Healthy People 2020. We need to know what the objectives for rural health are. This is slide 19. Okay. There may be lots of objectives that apply or that we think are good objectives for rural and migrant populations, but we're focused here on what Healthy People 2020 objectives are. Okay, a lot of people got Healthy People 2020 questions incorrect on the first exam, okay? Because there were other choices that sounded good, okay? But I told you in preparation, it may sound good, but is it part of Healthy 2020? Okay, I think it was the question about what is the best discussion to have with what does Healthy People advocate as one of their objectives for the best practice for discussion with new parents? Okay, All 4 answers were great answers, but only one of them was Healthy People 2020. Okay, it was positive parenting. That was the correct answer. Okay, but the other 3 were like discuss nutrition, great idea. Discuss reproductive choices, great idea. But they weren't Healthy People 2020. Okay.
Yeah,
So,
I wondered about that. I got that one wrong because I picked discussing communicable diseases because I was thinking new parents would be concerned about their child getting sick. So I originally picked the positive parenting and then I changed my answer, which we've been taught not to do, but I wondered about that one.
Yeah. So again, all 4 answers could be right if it didn't say Healthy People 2020, but it was asking specifically about Healthy People 2020.
Yeah.
Okay. So, and then use of technology, improving access and communication with rural. Okay, so that's a quickie on 22. Questions? Okay, 23. Let's talk about in the next exam, there's a lot of questions about this chapter. Specific, poverty, homelessness, teen pregnancy, and mental illness. This chapter is heavily covered on the next exam. So, and I'm not trying to give away anything, I'm just letting you guys know. Okay. Okay, let's go through the objectives for this chapter. Or have you guys answer some of these questions? What are some social, political, cultural, and environmental factors that influence poverty? Better yet, these are factors that do influence poverty. So the question I pose to you is, what influences poverty? Answer. So we're answering the objective. Social issues, political issues, cultural issues, environmental issues. All affect poverty. Okay. Discuss the efforts of poverty on the health and well-being of individuals, family, and communities. Well, let's talk about it. What are the negative effects of poverty on individuals, families, and communities? What are they? I'll start. Access to healthcare.
Access to good nutrition or housing.
Yep.
Clothing.
Education.
Income.
What?
Income.
Yep.
Yeah. Clothing, transportation.
Absolutely. Food, childcare,
Support system.
support systems, everything. Remember, we talked about this last week. This is a question that several people missed in exam 1. What is the key determining factor of, hang on, where is that question? What is the key determining factor of the well-being of an individual, family, or community? What is the #1 key factor that drives everything? Not to say there aren't poverty. Poverty. Okay, it drives everything. Okay, how is being homeless? How does being homeless affect the health and well-being of individuals, families, and communities? We have homeless parents, we have homeless infants, we have homeless newborns, homeless kids. I have tons of homeless families in my schools. Elementary school, middle school, high school. All kids are affected differently. Okay, what's affected when you're homeless? Everything. Okay, and then teen pregnancies. They're highlighted in this chapter. Poverty, homelessness, teen pregnancies, and mental illness. Those are 4 highlighted, very vulnerable populations that we need to talk about. Teen pregnancy. What are the issues with teen pregnancy? I mean, where do we start? What are some issues with teen pregnancies?
Lack of prenatal care.
Secrecy, don't want to tell anybody. Therefore, I won't go get care. What else?
Nutrition.
Nutrition. Level of education. Cognitive development. Understanding what's about to happen, this life transition. Okay, and then the other objectives go through at-risk adolescents. What might they face? Suicide, mental illness, explain nursing interventions for the poor and homeless people, pregnant teens, and their significant others. So let's just go through this. But you guys are going to have to do some of this on your own too. If nobody's looked at these, and I mean, I don't want to waste my time reading through it. Like I said, I'd rather get to Kahoots and test bank questions. But if you haven't reviewed the information, you're not going to be able to answer the Kahoot questions or, you know, the test bank questions. So I'm trying to do a quick review. Attitudes, beliefs. You know, what do you guys feel? What are your attitudes? You know, if you're walking down the street and see homeless camp, what do you think? Do you think, oh, they shouldn't be there, or they have every right to be there? Or what do you think when you see homeless teens? Not homeless, or homeless families, or homeless kids, or people at an intersection that are holding out, I need money, and have kids sitting there with them. I mean,
Actually,
what?
I was gonna say, I have two thoughts on that. Sometimes I think, you know, how sad it is, but then sometimes I also think that it's a scam.
Exactly. How do you know? You know, I mean, there's nothing more. There's a family that sits outside my grocery store. She's been there for about 6 months. She's got 3 little kids, probably under the age of 5. I can't drive by her without stopping and giving her a bag of food that I just bought from the grocery store for her. I can't help it. It's just I just can't help it. And you know, do you ever think, well, how do people get in these situations? I don't know. I mean, I don't know what your attitudes and beliefs are, but this chapter will really challenge your attitudes and beliefs. Okay. I mean, what do we think about mental illness? You know, we see somebody walking along the street, I don't know, without any clothes on, or screaming and yelling, and you know they're having a mental health crisis. What are your attitudes and beliefs about that? You'd be amazed. Okay. So what is your perspective? What is your individual responsibility? What is your cultural competency with regards to these groups? What role does the media play? Okay. Poverty and homelessness affect people's health status. That's a fact. Okay, there's different kinds of poverty. All right, persistent poverty, neighborhood poverty. Okay, so starting on slide 6 is poverty. Okay, so I need you to read through this. Okay, definitions of poverty. So it goes through, let's see, 6 through 9 is poverty. Okay, here's what we talked about this. Poverty has a negative effect on women of childbearing age, adolescent women, children, older adults. Okay, starting on slide 10, it talks about homelessness. Okay. Understanding homelessness, effects of homelessness. Okay. What are the effects of homelessness? Hypothermia, infestations, poor skin, diabetes, TB, HIV, trauma, mental illness, use of drugs. Who are the at-risk populations for homeless? Right here. Pregnant women, children, adolescents, older adults. So 10, 11, and 12 are homeless. And then 13 kicks into teen pregnancies. Teen pregnancy. Trends in adolescent sexual behavior and pregnancy. Okay, so you need to have a read through this. Teen pregnancy is slides 13 and 14. And then we get into mental illness. Who are the at-risk populations for mental illness? Listed right here in slide 15. Okay, this is an excellent slide to give you a good indication for this particular chapter with these 4 groups of levels of prevention. So please have a look at slide 16. Gives you examples of what primary, secondary, and tertiary are. And you guys did really well as a group. There were, I think, 4 levels, maybe 5 levels of prevention questions on the last exam. You guys did really well on that, which is great because you already are developing your understanding of levels of prevention and are able to apply it to different topics. So these are levels of prevention for these 4 vulnerable populations. Okay. And then what is our role dealing with these populations? Okay, creating a trusting environment, showing respect, compassion, concern. We need to try not to make assumptions. We need to help coordinate a network of services and providers. What if you're working with the homeless population? You'll want to have a network of services and providers that you can give them. Right? We try and focus on prevention of homelessness, prevention of mental illness, prevention of teen pregnancy. Right? And then the last one is an important one, develop a network of support for yourself. These are hard populations to work with, challenging, draining. Okay. And then let's go to number 24. 24, which is, again, another hard topic, another hard chapter. Okay, 23 and 24 are hard chapters to wrap your arms around. Alcohol, tobacco, and other drug problems in the community. Okay, so what do we want to focus on? Let's take a look and see what our objectives are. What are our attitudes about alcohol, tobacco, and other drug problems? What are our attitudes about drunk people? I don't know, out in public, in bars, whatever. What are our attitudes about drug users, dealers? What are our attitudes about the opioid crisis, overdoses? It's a real issue. This is another topic that people pick for their vulnerable populations is drug abuse in their communities. Really sad stuff. Really sad stuff. Okay, one of your objectives is to differentiate among substance abuse, dependence, and addiction. There is a difference. Okay, there's a nice little, let's see, we're on chapter 24. There's a nice little box in chapter 24 in the book that goes through the differences. What's the difference of the 4 of them? Right, discuss the differences among the major psychoactive drugs, depressants, stimulants, marijuana, hallucinogen, inhalants. Okay, what's our role in primary, secondary, tertiary prevention? What are the effects of substance abuse on a community and people within the community? Or just think of a family. What are the effects of substance abuse on a family? Right? So, substance abuse is the #1 national health problem. Okay, we know that a substance abuser is not only at risk for personal health problems, but also maybe a threat to the health and safety of family members, co-workers, members of the community. Okay, so this is a really important chapter to go through. Start with the PowerPoints, okay? ATOD is alcohol, tobacco, and other drug. That's what that refers to, okay? Abuse and addiction can cause multiple health problems, okay? Here's your different definitions. You're gonna have to go look those up if you don't know them. Okay, what are psycho, and then it goes through the different categories. What are psychoactive drugs? Okay. Psychoactive drugs as a whole. Then what are psychoactive drugs that are depressants? What do they do? What about the psychoactive drugs that are stimulants? Alcohol. Tobacco. What are the effects of tobacco? Smoking is the foremost preventable disease cause of death in the United States. Okay, so go through that. Caffeine. Heroin. Now we're into the illicit drugs. Heroin, most often recreationally used opioid. Cocaine, amphetamines. Now you don't need to know every single thing on these slides, but just knowing the different categories of potentially what will be abused. Marijuana. Boy, have we created a mess with marijuana, huh? You know, whether you believe that it should be legal or not, doesn't matter. I don't have an opinion one way or the other. Colorado, it's all over the place. Okay, but it does come with the unintended consequences. Hallucinogenic drugs, inhalants. Okay, and then again, this has slides 19, 20, and 21 are excellent. Okay, they go through, there's 3 separate slides, goes through with this population, examples of primary prevention. So here we see drug education, promoting healthy lifestyles with primary. Secondary, we talk about screening. Who are our high-risk groups that we want to screen? And tertiary, they already have the issue. Tertiary would be helping them through detox, treatment, smoking cessation programs, support groups, because they already have the issue. And what's our role? Knowledge of community resources, how to mobilize them, right?
I'm sorry, I may have missed it. What's the acronym ATOD?
Alcohol, tobacco, and other drugs.
Okay, thanks.
Yep. Okay, so there's a quick review of, last week's chapters. I want to go through, I'd rather do the test bank real quick and see how you guys do. I have the answers with me, but let's go through these. So let's see, it's 3:06. I do want to get through week 4, but let's go through some of these questions and see how you guys do. I mean, again, you've only learned what I've taught you in the last 45 minutes, actually in the last 30 minutes. So would you rather do the Kahoot? Would that be easier, or do you want to go through this? Or start to go through it?
I think the questions.
The questions. I think that these questions are, okay. Let's see, okay. A resident in the rural community has been diagnosed with asthma. Which of the following providers will most likely provide care? What's your answer?
A.
Absolutely. A, nurse practitioner. right? Because they probably don't have an allergist, pediatrician, or pulmonologist on call or in the rural community, right? Which of the following best describes a health professional shortage area?
C.
Just call it out. C, correct. A region with insufficient number of healthcare providers. And these are like NCLEX questions. The Cahoots these are more like NCLEX. So that's why I want to go through some of these with you. Does everybody understand that? And you know what? Let me stop sharing for 1 second. Are we all okay doing this? Do you guys want to do something like this activity after going through the 3 chapters?
This is fine.
That's fine.
Is this helpful?
Yes.
Yes, ma'am.
Okay, the other thing too that we didn't go through that I want you to go through, because we put together our exam based on case studies as well. So I need you to go back and read those instructor case studies that I send you on Sunday nights for chapters 22, 23, and 24. Okay, so this week I sent you a PowerPoint. We combined all 3 chapters. Anybody see that yet? It's all combined together in one PowerPoint. It's all the 3 case studies. I didn't send you 3 separate case studies. I sent you a combined. Okay. Okay. Let's keep going with, okay, number 3, a migrant farm worker has been injured while working on the farm. Which of the following would provide assistance to care for the injury?
A.
Okay. A is the correct answer. Okay. Only a nurse can count on using, let's see. We need to send injured workers to emergency departments for immediate care. Okay, farming and ranching, I'm reading rationales now. Farming and ranching do not fall into OSHA guidelines. Okay, because they're considered small enterprises. Okay, does that make sense? So just because they're working in a farm doesn't mean they don't have access to emergency departments for immediate care. It may not be right next to the farm, but that's where they need to get. Okay. The nurse is caring for a migrant farm worker who has been working in the agricultural industry for 10 years. When questioned about environmental hazards, the client reports regular exposure to pesticides. Which of the following disorders is the client most at risk to develop?
A.
A.
C.
A.
A. Chronic exposure to pesticides and chemicals may lead to cancer. Okay. Memory loss, skin rashes, and headaches are all potential side effects of short-term exposure to pesticides and chemicals. Okay. 5, migrant farm worker presents to the clinic reporting an acute onset of severe abdominal pain, nausea, vomiting, diarrhea, headache with difficulty concentrating. Which of the following conditions may cause such symptoms?
C.
Okay. Yeah, because what are the migrant workers most susceptible of being exposed to?
Poison.
Pesticide, yeah. In addition to those barriers faced by many residents in rural areas, what additional health barriers to health care is a Hispanic migrant farm worker likely to encounter? So here, for number 6, I'll tell you that in a minute. Go ahead and answer it.
A. B.
Okay, the answer is A. Okay, so here's your rationale. For migrant workers, a language barrier and cultural differences often exist between them and other area residents, including healthcare providers, right? This is an additional barrier that's not faced by other rural residents. Okay, makes sense? Okay, do you want to keep going? I'm going to do 10 of them, and then we're going to go cover the 2 chapters in week 4. Okay. Which of the following is the most accurate description of a migrant farm worker?
C.
Everybody agree with C? C is
Yeah.
the correct answer. Why don't you guys, I'm losing my voice. Why don't you guys read number 8 and tell me what the right answer is?
An employer provides a migrant farm family the day off to visit the health clinic in a nearby community and tells all of the time they need. However, the family arrives at the clinic appearing very stressed. In addition to the health issue, which of the following would most likely be a fear experienced by the family?
D.
D.
He's
D.
correct. D. Good job, you guys. Really good job. Okay.
What was the answer to 7, Professor Marvel?
What now?
C.
7 was
Thank
C. 8 was D. And you guys just read 9 quietly to yourself and tell me what you think the answer is. Just call it out.
C.
Yep. C is correct. Good job. Number 10. If you guys go into chapter 22, there is a table in there that talks about, I think, 4 different cultures: Asian Americans, African Americans, Native Americans, and Mexican Americans. And it goes through how each of them react to different things. This is one of those questions. Go ahead.
B.
What's
A.
the answer
B.
number 10?
B.
B. Okay. Let's do a few more. 11. I mean, there's 70 questions, so we're not going to get through all those. Okay, what's number 11?
It's A.
Mm-hmm.
Good job, you guys. Good job. Okay, number 12.
We'll go with B.
Great. Yeah, you got to get involved in your rural community, right? How are you going to learn about it? Involvement in your community, provide more contact with community residents than urban areas. Got to get out there and walk the walk. Okay, 13.
D.
Mm-hmm.
D.
Yep, perfect. Treat the client who has the exposure. They already have the exposure. Excellent. 14. Okay, the answer is B. B as in boy, here's why. Let me read you the rationale. The causes of poverty are complex and include decreased earnings, increased unemployment rates, inadequate education and job skills. Thus, it's most likely that he wasn't able to meet his basic needs through his current employer. If he had already eaten his meal, it would be unusual to get additional food out of the garbage. Rather, he should be able to afford to purchase additional food if he was able to purchase his meal. Okay. 15.
We go with B.
B.
B. Yep. In 2014, the poverty rate for children under 18 was 21.2%. Okay, 16.
C.
C.
Absolutely. Yep. Homelessness leads to more school absences. That's a fact. 17. All right, we'll go up to 20 and we'll stop.
Sorry, did you say A or C? For the
C.
last one?
Yep,
Okay,
C.
thank you.
18. Or sorry, 17.
C.
B.
B is the right answer. Why? Poverty increases the likelihood of chronic diseases, injuries, traumatic death, and developmental delays, and poor nutrition. Okay, homeless children typically may have delayed communication, more mental health problems, and histories of abuse. Okay, so because this child is attending school, they should be eligible for the free lunches. So they would have adequate food. Okay. $18. We just went through this.
B.
B is right. Families with children are the fastest growing segment of the homeless population, with the highest rates being found in the rural areas. Interesting, huh? Adolescents.
Sad.
What?
It's sad.
Yeah, it's horrible. Not to get off on a sidetrack, but this pandemic has forced many families that would have never imagined themselves homeless into a homeless situation. Many families with parents losing jobs, and it's awful. Adolescents, persons in crisis, single men are not the fastest. So the other three are not the fastest, but there are pockets of homelessness with the other three, but the most rapidly growing is the families with children. Okay, 19. Okay, the answer in 19 is D. Okay. Homeless people have the same problems accessing care as do others in poverty. Therefore, Health of the homeless person is usually crisis-oriented and sought through emergency departments. Okay, let's do one more. C 20. They had what?
B.
Yep,
B.
B's the right answer. Yep. Yep. Are for daily access to a room with soap, water, and bandages. Yep. Yep. Okay, was that helpful to go through some of those?
Yes.
Okay. All right, let's cover week 4, which is faith community nursing. I'd like to just do the same thing. Go through the objectives in the 2 PowerPoints, and you can read the case studies on your own. I sent you another combined one. Okay, it's a combined, it's the same PowerPoints I sent you for weeks 1 and 2, although I sent those separately. One of our other professors is combining all these case studies, weekly case studies, into one PowerPoint. So for weeks 3 and 4, they're combined, which is easier for you guys. Okay, so let's, what do you guys, when you guys think of a faith community nurse, what do you think of? What do you think a faith community nurse does?
Sorry, repeat that again.
Oh, hang on. I just want to show you. This is your week 3 case studies that I sent you on Sunday, with that is a combination of chapters 22, 23, and 24 right here. Okay, that's week 3. Week 4 is this. Okay, that's this week. It's chapters 29 and 30. That's the case studies, not the student case studies from your chapter in the book, but these are the case studies that come from our instructor lesson plans. So these are good ones. And like I said, do not ignore reading case studies for your chapter review, because we do take the essential knowledge and concepts out of case studies and form them into exam questions. And I've told you that several times already. So it is important to review the PowerPoints, but it's just as important to review the case studies. And we're trying to make it easier for you with Dr. Apple doing the PowerPoint, combining the chapters for the week. Okay? Okay. So let's go through 20. When you guys think of faith community nurse, what do you think? What does a faith community nurse do? What is a faith community nurse? Do you know any?
Is that like a chaplain? I don't know.
Did you say child find?
No, like a chaplain, like somebody that go talk to people. Like, I don't know. I'm thinking a bit different.
Okay. Define faith community in nursing and holistic health promotion. Okay, so let's go through the faith community nursing is whatever faith you practice, whether it's a Catholic church, a Protestant church, a mosque, a synagogue, wherever you practice your faith, there's potentially a faith community nurse. Okay, so for me, my faith, I practice is in a Catholic church. Somebody else may practice their faith in a mosque. So it's wherever you choose to practice your faith. Okay, so for example, in my congregation, we have 2 faith community nurses. They go out and do visits to new parents to help them, teach them parenting skills. They may do grief support groups for the death of a family member. They may do, what else? They support the health ministries of whatever faith-based area you're in. Does that make sense? We've all heard of health ministries. They could do health fairs. Okay, they could visit the elderly. Some may provide some nursing care, others may not. Okay. So faith community nurse is also called a parish nurse. Okay, so here's 4 good bullets on what faith community nurses might do. All right, so we just talked about this. They may establish programs and services that significantly affect the health, healing, and wholeness. Okay, so have a look at slide 3. Okay, this is exactly what the definition of faith nursing is, and you need to know this. Okay, definitions in faith community nursing. All right, so what is a faith community? Groups of people that gather in churches, cathedrals, synagogues, mosques, and acknowledge their faith. Parish nurses, also called faith nurses, respond to health. Parish nurse is just not for a Catholic. Okay, a parish is considered wherever you practice your faith. They respond to health, wellness needs of populations in your faith communities, and they partner with the church on whatever the mission of the health ministry is. What's a health ministry? Okay, these are different activities and programs within your faith community. Here's some other examples. We just went over a couple. Visiting the homebound, providing meals for families in crisis, prayer circles, volunteering, grief support groups. Okay, this is something you need to know. There's 2 models of faith community nursing. This is slide 5. There's a congregational model and there's an institutional model. Very simple. Congregational model is that the faith nurse is only working in the particular congregation, in the particular church, in the particular mosque, in the particular synagogue. Okay, they're just working with their own faith community. That's it. Okay, right here, the nurse is accountable to the congregation only. All right, that's typically what faith nurses do. However, if let's say the community has a lot of health needs, but the faith nurse can't do everything. She can't be the IV nurse. She can't on home visits. She can't be the wound nurse. She can't be the medication nurse. Just too much. Okay, then she may function or coordinate within the institutional model, which is collaboration with, say, maybe a home health agency that will send a wound nurse out, or will send a IV nurse out, or will send a home health nurse out. Does that make sense? In the rural community, the faith nurse may be doing everything, right? She may be handling the congregation and doing everything else, meaning she's not collaborating with anybody. But seeing an urban setting, you might be collaborating, you might be collaborating with home health agency, a wound care agency, a IV agency, a COVID testing community, a urgent care. Does that make sense? It's right here in the slide. Includes greater collaborations and partnerships than the congregational model. Okay, so the nurse may be in a contractual, we may have to contract out with hospitals, medical centers, long-term care. Make sense? Okay. Okay, faith community nursing practice. I want you to read slide 7. The highlight is that the spiritual, whatever spiritual it is a central dimension to the practice of nursing. Okay, so whether you're Catholic, Protestant, Lutheran, Muslim, Jewish, it doesn't matter. The spiritual dimension of whatever your faith is now the central practice of your nursing. Okay. I want you to read the full slide of chapter 7 and chapter 8. 7 and 8, you need to know. Okay. What are some professional issues that might come up in faith community nursing?
Sorry, you said to know slide 7 and 8. Which chapter is this?
We're in chapter 29.
Okay.
Slide 7 and 8. Number 9, you can read through, because in school nursing, faith nursing, home health nursing, hospice nursing, occupational health nursing, there's always issues that are going to come up. And we separate them out into and you'll see this when we cover each of the chapters of these different community nursing roles. We have professional issues, we have ethical issues, we have legal issues, and we have financial issues. Those are 4. Okay, they come up in each chapter with different roles of the nurse. So I want you to read through it. Slide 9, 10, 11, 12. And this is for the faith community nurse. Issues, professional issues, ethical issues, legal issues, and financial issues. Okay. And then please know the Healthy People 2020 objectives. So go to chapter 29, find your Healthy People 2020 box, and please know that. Okay. What are some of the functions of the faith community nurse? We've talked about this, but I want you to read through it. We could be doing lots of different things. Like in my parish, the faith community nurses are the only ones, they go out and visit every single every single person that comes home from the hospital. They do a home visit. They visit every single new family that comes home with a new baby, or at least offers to. Okay, so it just depends on what the ministry's goals are. They go out, they're the ones who go out and do the communion, Eucharistic communion in the community. And at least in my parish, they contract out all the healthcare. They contract out PT, OT, vaccinations. They contract out all the medical stuff. Okay, their primary role in my parish is focused on education, supportive and education. Okay.
So do they work with like insurance companies as well?
Yeah, absolutely.
Okay.
Yep, that's that partnership with the institutional model. Okay, they're working with insurance companies, with hospitals, with long-term care facilities, maybe with rec centers to provide, bus companies to provide transportation for them to go on day trips, whatever it is. Okay. And then chapter 30 is the next role. It is, these are grouped together. Home health and hospice is grouped together. Okay. So again, it's a different role in the community. All right, so compare different practice models for home and community-based services. What are the basic roles and responsibilities of home health, palliative, and hospice nurses? Okay, you can read through the objectives and please be able to articulate the objectives, right? We know that home is a place where nurses have provided care for more than a century, right? We know that home gives the clients and the families a chance to receive care, health care in their home environment, a comfortable home environment, right? We know that the best place to provide care is in the home. And we know that tons of healthcare has shifted to the home setting over the last 10 years, right? So for clients who are homebound, home care, maybe home health may be the only option they have. And then chapter 4 tells you what home care is. Home care is disease prevention, health promotion, episodic illness-related services. So IV infusion, wound care, PT, OT. Okay, so the theory and research suggests that the optimum location for certain health and nursing services is in the home. And then we also have to be mindful of the family that's caring. Okay, you can't leave them out of the equation. So I want you to read slide 5, and then slide 6, definitely, working in the client's home, right? Remember, you're a guest. You have to establish trust. You have to be culturally competent. I mean, with our diverse population now, any home visit you do could be with any culture. Okay, we don't need to know the history of home care. Okay, here's your practice models. This is one of your attestation questions. Okay, there's 5 practice models in home/hospice care. Right? I put this on a card: population-focused home care, transitional care, right? Maybe transitioning from one level to the other, hospital to home, home to assisted living to nursing home. Okay, then you have home-based primary care. Just read through these definitions: home health and hospice. Okay, I need you to know these 5 practice models. I don't need you to know everything in these 2 slides, but just a real short description of what each practice model is and how many there are. Okay, what are the scope and standards of practice? We have direct care, we have indirect care, we have nursing roles and home care. We have scope and we have code of ethics. We have standards of practice. Hospice has their own standards of practice. Home health has their own standards of practice. Okay. Don't forget about quality management in the home setting. It just doesn't happen in the hospitals. Okay, what does accountability and quality management look like in the home care setting? Well, just like the hospital, it's evidence-based performance improvement. Again, apply your accountability, your quality assurance, quality improvement activities. Apply that in the hospital, apply it into the community setting. You have to have standards to which the home health and hospice nurse functions under. Just like the hospitals, home health is accredited. Okay, and here's your issues: legal, ethical, financial aspects of home care, just like we did with the faith community nurse. Okay, so that's 18, 19, and 20 are legal, ethical, and financial aspects of it. And then here in this, it's mentioned the National Healthy People 2020. Please go to chapter 30 and look at your Healthy People 2020 box. What are the Healthy People 2020 goals and objectives for home health/hospice? Okay.
Professor Marvel, I have a quick question in regards to the Healthy People 2020 boxes.
Yeah.
So I'm on page 535 looking at the chapter 30 Healthy People 2020 objectives. Mm-hmm. And it's the little box at the bottom. Like, what does the AOCBC-11 mean? Like, the bold print that's in front of each objective. I just need to know, like, is there one that we need to more so focus on more than the
That's a reference to the Healthy People 2020 site. It's the section that information is found in. You don't need to worry about any of that. Just know what the goals and objectives are.
Okay. So
they
just
all
like
represent.
the question,
go ahead.
Just like the question that we had on the exam that only had like one specific answer, like how do we know which one is more important than the other, being that it's a whole list of
You're not going to get a question on any 3 of our exams that's which is more important. You're not. It's either going to be one answer or select all that apply.
Okay.
You're not going to get that. You're not going to get a trick question like that. You're not. Okay. So, I think before we get into this, what I would like to do is let's go to week 3 interactive lecture. Let's go. Oh, you've already done week 3. Let's go to week 4 interactive lecture. What's the first question? Oh, first question is, what's the difference between congregational and institutional model? What is it? Remember, the congregation model is you're a faith community.
Specific to your
congregation
or organization.
Exactly. So congregational parish nursing is what Danielle said, you're specifically working with your own organization. And then what's institutional?
It's a greater collaboration with that area, other like hospitals, medical centers.
Yep. Mm-hmm. Nursing agencies, home health agencies. Right. So you're collaborating with people in the community. Okay, the second question is that you need to list those 5 models. Do you remember what they were? Or do we need to go back to the PowerPoints? Or can somebody pull up the PowerPoint and tell your teammates what they are? You don't have to list what they all, each of them, just list the 5. That's it. What are they?
Population focused home care.
Okay. That's 1.
Transitional care in the home.
2.
Home-based primary care.
Yep. 3. Good.
Home health and hospice.
Yep. 4. Yep. And what's the 5th one?
Hospice.
Okay. So if you guys could all be filling out your attestations now and just hit submit so that they're all done and you get credit for today, please. I'm not sure I understand why people come to the class, people are here, and then after the class, I go in and start not grading it, but just giving you guys credit for your submissions, why there's half a dozen people who don't submit it. Because you just run the risk of forgetting to do it down the road, which is why I try to do it during class. So you guys tell me when you're ready to do a couple of questions in this week 4 testing bank. Where can I start? We got a lot covered today, you guys. I think we did.
Professor Marvel, do you know how soon the study guide for exam 2 will be going out?
Hopefully in the next couple of days, we're working on it.
Okay.
Yep. Okay, let's go through these questions. Start. Number one, whoever wants to get going with these questions, I'm ready to go. Number one, go ahead. Just read them silently and call out the answer. Number one's easy. Are you still working on your attestation, or do you not know the answer to number one?
Is it A?
Yes. What's parish nursing? Affiliation with a church or congregation. We just went through that. Okay, B, or excuse me, 2. We just went through this.
Health ministries, B.
Yep, B, correct. That's it. What that question describes is it's a perfect description of what a health ministry is, or one example of a health ministry. Okay, number 3. What do we pull into the faith community nurse role that's different from the other roles?
D.
No, the answer is A, because in the faith community, you're pulling in your beliefs and your traditions, right? That's the whole purpose of a faith community nurse. It's holistic, but it also pulls in the spiritual aspect of it, correct?
Yes.
Okay, so the answer is A. That's the difference. That's the extra focus of that nurse who has the title of faith community. She's bringing the faith into her role. Okay, number 4. Again, that piggybacks off 3.
C.
What?
Is it C?
Yep.
Spiritual.
C. Yep. I want to read you the rationale for number 3. Which of the following best describes why it's helpful to be a member of the faith community? People who encounter assaults with physical and emotional illnesses and brokenness, and who are able to call upon their faith, beliefs, and religious traditions, are able to increase coping skills and realize spiritual growth even during adversity. Family communities do allow for social outlet, asking others for help. However, the common connect of faith and traditions is what connects the members together and allows them to accomplish these other things. Make sense? Okay. And then I'll just read the first paragraph of 4, the rationale. The spiritual dimension of healthcare is central to the practice of parish nursing. Okay. Okay, number 5. I like this question. I love this question.
C.
Mm-hmm.
Oh, C, because we're talking about a parish nurse, and we're bringing in the faith part of this. Great. 6.
C.
Yep. C. Do you guys need a rationale for that, or do you understand that? Health, spiritual health, and healing are considered parts of an ongoing dynamic process. Okay. 7. One of the things that I think I should do going forward is, it's fine to cover as many questions as we can, but I wonder if I should try and do a separate review, like test question review, test bank review question, in addition to class. Just so that you can go through, like week 3 had 70 questions. This one has 48 questions. So obviously we're not going to get to all of them, but I don't know.
Do you have those questions posted anywhere?
No, and I can't. These come from a test bank that's why I'm trying to go through them and trying to figure out, if these are helpful. I need to think about that, because I think one of the other professors is doing a review with NCLEX questions as well. So I need to get with her and figure out, but I want you guys to have the availability to be able to attend something like that. So let me think about that. Okay, number 7. Let's do number 7.
A.
What is it?
A.
Nope.
No.
D.
Yep. Scope and standards of faith community have been developed and revised. Remember, every aspect of community nursing has their own scope and standards. So hospice has its own scope and standards of care. Home health does. School nursing does. Faith community does. Occupational nursing does. Okay. 8. This is one of those ethical issues in faith community nursing.
B.
B, right?
Yeah.
B, absolutely B. Okay. Number 9. I like going through these better than the Kahoots. Do you guys? I'm just asking. And I sent you the Kahoots, so you can go through the Kahoots on your own, correct? This I can't share with you unless we do it in person like this. So, I know Kahoots is kind of a, competitive game, but if you can do it on your own, it's more of a question answer, kind of like the case studies. Sorry, I didn't mean to get off track. What are we on? What number are we on? 9?
Yeah.
Yes. What's 9? Okay. This is in your book, so I'll answer this for you. Okay. In order to be a faith community nurse, you need to have a bachelor's education, including community health and nursing experience. Okay, so let me give you there's certain current educational preparation for the parish nurse includes successful completion of extensive continuing education, contact hours, or designated coursework in the parish nurse preparation at the baccalaureate or graduate level. Okay, as well as a thorough grasp of scope and standards of practice. Okay. Okay, go to 10. Let's go to 10. This should be pretty easy to you.
Is it D?
Yeah, absolutely. Absolutely. 11. Uh, 11 should be a no-brainer to you guys as well. What's 11?
D.
Yeah.
D.
12. Yep, 12. Ooh, we got a healthy people 2020 here.
See,
Correct. Correct. 13.
B.
Yep. I mean, look at the question. The question is asking for, it's talking about evaluation. So you're going to pick an answer that has evaluation in it, right?
Mm-hmm.
That was number 13. Yep. 14. You guys are doing good. You guys are doing really good. Proud of you. What are we on? 14. Right? This is kind of a weird question. 14. The answer is B. Pastoral care is a service ministry formalized by the church or faith community. Oh, not necessarily involving the pastor. Right, so the nurse can fulfill the role of pastoral care through stressing the spiritual dimension of nursing. Okay, does that make sense?
you said B or D?
B.
Oh.
B as in boy. Okay, 15.
B.
B.
B. Yay, good job. Yay, yay, yay. 16. Okay, I'll give you it's A, all right, because think about it. If she's working within her congregation, she's very autonomous. That's one of the characteristics of the congregational model, is that you are very autonomous working on your own. Okay, all right, 17.
Exam today. Which? Oh, that's a Zoom too.
What's number
I
17?
have to like be proper, which sucks.
What? Somebody mute themselves, whoever. Oh my gosh.
After class, I gotta do dishes.
Bingo. Okay, number 17. Coordination of volunteers, D, right? She's organizing an annual health fair. So all these people have to come in and set up and perform, and what's her role? It's going to be coordination of volunteers, because everybody else is going to be the health educator and whatever they're doing, right? So she's coordinating it. 18. Primary.
B.
So what'd you say?
B.
Yep. 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 Excellent. Good. Yay. What's D? What's this? Working with parents of obese children to implement lifestyle changes. What's that? Tertiary, right? You already have children that are obese. Now you have to work with the parents. Okay, what's C? Secondary, you're doing screening, supervising height, weight measurements, right? Early intervention, early identification, right? Okay, 19. Sorry, I didn't mean to throw you off there. I was getting excited that you were getting all these right. This should be an easy one, 19.
B?
B as in boy?
Yes.
Correct. And then last one for now is 20.
B.
Yep. Excellent. Guys did really good. I'm proud of you. You did good. Okay. Was this format helpful?
Yeah.
Yep.
Okay. All right. So now we're caught up on weeks 3 and 4.
Are these the type of questions we can expect to see on the test, or
no, not necessarily.
More HESI type questions?
HESI type questions. Yes. HESI type questions. Yep.
Okay.
Yep. I appreciate all your feedback at the beginning of class with regards to the last exam. I'll bring that back to the group. I don't want to keep you over. We got the attestation done. We covered weeks 3 and 4. You'll have the study guide in the next couple of days. Please be thinking about your vulnerable populations. Somebody in your group, please submit to me the infectious disease you're going to do. And next week, we'll spend the first hour covering week 5 chapters, and then we'll spend the second hour reviewing the study guide. Did I think of everything there? And then I really need you guys that want to review the exam. I mean, it's always helpful to go over what you missed. I mean, this information, not necessarily the types of questions, but the topics are going to come up in your HESI. So I'm going to leave it all up to you. I mean, I'm here to help you. If you want my help, I'm happy to give it to you. Okay.
Okay, thank you. Bye.
Has this been helpful?
Yes, it has.
Okay, great. Good. All right, everybody, bye. Have a good day. Reach out if you need anything, please. Okay?
Can I ask you a quick question, Professor Marvel?
Yes, go ahead.
So about the whole attendance for 2 weeks. So I did